All right, George and Millie just went to attack those foreign dogs that are barking on the computer, which is actually them. All right, we have to go inform George that the house is not under attack. Yes, Cheyenne, it is extremely cold this morning. Actually, it's pretty brutal outside. I went out to give Booger his medication and take the trash out and decided that I really don't want to spend much time outside today. It's pretty brutal. Those up north are probably suffering a little more than we are. Okay, so today's busy day. It's surgery day. I know I have 4 animals coming in for tumor removals today. So that's actually what we're going to talk about today. But I'm also going to give you a reminder that this weekend is the Chantilly Super Pets Expo in Chantilly, Virginia. And I will be speaking 4 times this weekend. Looking forward to seeing the carpenters who have graciously volunteered to come help us this weekend because they live pretty close to there. And tomorrow is Friday. I think it starts at 3, and at 4 p.m. I will be speaking on food is the foundation of life, using food for healing. Saturday morning at 10:30, I will be doing my Cats Are Not Small Dogs talk on how to home cook for your cats. And on Sunday, I will be speaking twice, and I don't remember the exact times. It's like 10:30 and 3 or something. And those are on yin and yang theory of food and using food to treat disease. So, going to be a busy, hey Mike, it's going to be a busy weekend for sure. So today when Megan gets done being receptionist, then she's going to be inventory specialist and pack up all of our stuff for the weekend. So a little bit crazy. All right, so let's talk about tumors, when they should come off, when you can ignore them. The tips or suggestions for feeding a Cavalier with no teeth. Her tongue control is getting worse. So the teeth are not the problem. The tongue is the problem because we have quite a few dogs with no teeth and they eat the raw with no problem. So you're just going to have to find the consistency that works best for her. Some of them do better with things a little bit soupier, so you can add more water. I would think in her case, maybe having it be a little bit more solid. So maybe, depending on which raw you're feeding, maybe if you gently cook it to make it just a little more solid, it might work a little better for her. Okay, so let's talk about tumors. Oh, good, Renee. I'm looking forward to meeting you and seeing you. I don't think we've met in person. Okay. Tumors. When do they need to come off? So in our office, my recommendation is that when you find a new lump or bump, so, this is the best way to find a new lump or bump. Just pet your dogs every day, rub all their different body parts, rub their bellies, particularly on the girls, feel those mammary glands. Pick up their legs, run down each leg. Anytime you find a new lump or bump, really check it out to see what it is. What you might be feeling is a blown up tick. It might not be something that you have to be really concerned about, but anytime you feel something, you should definitely take a close look at it. And then if it truly is a new lump or bump, or if it is an old lump or bump that has changed either in look or feel, or if the dog or cat are really paying attention to it, they're licking it a lot, those are signs that you should go in and ask to have that checked. And when your veterinarian looks at the lumps, it shouldn't be just a quick, oh yeah, look, that's a lump. There should be more to it than that. Now, there are some lumps, for instance, papillomas, which are basically warts. 9 times out of 10, I can look at it and say, yes, that looks like a true papilloma. But even then, there's a good chance I'm going to get a slide and do what we call an impression smear. So basically, I would isolate the lump, take my microscope slide, press it on there, swirl it around a little bit, and then look under the microscope at any cells that I've picked up on the slide. And you'd be amazed how many cells will come off on a slide just by doing that. We're all shedding cells all the time. And so are they. So it's pretty easy to get some cells on a slide and then stain them and look under the microscope. And as veterinarians, we are trained in school to do microscopic pathology. It doesn't mean we all like it, and it doesn't mean we're all good at it, but we are trained to do it. A lot of offices have technicians who really enjoy it and are really good at it. So And if they don't have anyone in office, they can always send it out to a lab to be looked at. It just usually ends up costing a little bit more to do it that way. So usually what we'll do in our office is we'll take an impression smear of a lump, and then we'll stain it. We'll look at it under the microscope. And at that point, what I'm really looking to see, one, did I get any cells? Two, do those cells look normal or abnormal? I'm not a pathologist, and I'm not going to say to you, oh, this is absolutely a fibrosarcoma, or this is absolutely a melanoma. I'm going to look at it and say, oh boy, there's some cells in there that are really abnormal, or nope, looks all good, all normal cells, nothing to worry about. And then it becomes optional whether or not that lump needs to have something more done with it. If we don't get any cells, or if the lump is smooth and covered with skin and the lump is actually buried under the skin, then the other thing that we can do is we can stick a needle into the lump and do what we call aspirate, which is attach a syringe and pull some cells out of the center of the lump. Then we can put that on the microscope slide, stain it, and look at it. And really, we should be doing that with any new lumps that are found, because we need to know, is this something that is potentially malignant, potentially life-threatening, or is it just a fatty tumor, which is, something very benign and nothing to worry about? So, do fatty tumors, which are lipomas, have a certain look and feel? Yes, they do. But with that said, I can look at something and feel it, look at the location on the body and say, well, I think it's probably a lipoma, but I cannot tell you for sure unless I get some cells and actually look at it. There are some tumors that are great imitators, mast cell tumors in particular. They are great imitators, and they can look like anything. Very commonly, they might look like an extra skin tag or a little, it looks like almost a nipple hanging down that's a little bit different or large. Those can actually be mast cell tumors, and those are potentially malignant and deadly. So, don't just look at something and write it off and say, oh, that's a big nothing. Now, if it's a lump that has been there unchanged for 5 years, it's probably a nothing, because if it was a something, it probably would have done more than just sit there for 5 years. So anything that changes suddenly, has irregular borders, kind of like, when you go to the doctor and they tell you to look for moles that have changed, that sort of thing. Same thing applies for these guys. Melanomas are actually not that common on these dogs, although we do see them. We also see something called amelanotic melanomas, which means that they don't have color. They're actually white, but they're a melanoma, and they can be just as aggressive. As a matter of fact, they can be more aggressive. So today, I know what a few of the masses are that I'm going after. We have a cat that's coming in that's a little bit of a nightmare story. The cat had, a couple of years ago, she had a lump on her front leg, kind of down on the forearm, and we removed it, and it came back as a mast cell tumor. Mast cell tumors are not as common in cats as they are in dogs, and they're a little less predictable. They generally tend to come back in just the same area and not spread and be malignant, but if they do decide to become malignant, they are very, very malignant in cats. So we got it off, and we decided to put the cat on our herbal protocol because the owner did not want to have chemo and radiation, understandably. So we tried our herbal protocol, and I have a really good herbal protocol for mast cell tumors that tends to work very well. The biggest problem was that we were dealing with a cat, and the cat and the owner fought for a few weeks and got most of the herbs in, and then said, you know what, I'm just not going to fight with this cat anymore. She stopped giving the herbs. And I get it, I understand it. She also opted not to have chemo or radiation. I get it, I understand that too. And we sat and waited. And yeah, it didn't take all that long for this thing to pop back up. And so we went back to surgery again and removed a mast cell tumor again. Didn't do any kind of herbal therapy or anything at that point. And if I remember correctly, I think this cat is still even eating a little bit of dry food, which is really not helping our situation. But it came back again. And so Dr. Anthony was on the surgery day that the cat came in this time. And when he looked at the leg and saw how much of the leg had been taken over by the tumor, and it was extensively spreading and really not removable with clean margins or even close. And he recommended amputation of the leg. And unfortunately, when I saw the cat prior to surgery, that hadn't really crossed my mind. I knew we weren't going to be able to get clean borders, but I didn't realize how extensive the tumor was until Dr. Anthony got in there and saw the surgical site and said, boy, this is really a mess. So when he called the owner with the cat under anesthesia and recommended amputation, it kind of hit her out of the blue. It's kind of like what I was talking about on Sunday with, you kind of have to preempt things a little bit and kind of walk your way up the ladder, or in this case, down the depths into the pit. And so it really came as a shock to her, and she couldn't make a decision, and she was just very upset. And so she said no. And I get it. I might have done the same thing at the same time. It's kind of one of those, oh my gosh, you can't ask me to make that decision in 30 seconds. So he got as much of the tumor as he could, and that was only about 3 weeks ago. And again, Kat is not able to be put on any kind of supplements because she just won't take them. And our biopsy came back this time as something much worse. The pathologist was not able to identify it on the first biopsy. We're waiting for additional stains, but it is now either a fibrosarcoma or an amelanotic melanoma, both of which are extremely aggressive and are a much, much bigger problem. So we're still waiting for our absolute diagnosis. In the meantime, the cat came in on Monday, and now she's got a golf ball sized lump in her armpit, kind of on the side of her chest, which may be a lymph node, although it's back a little bit far, so I'm concerned that it's something much worse. We took x-rays, nothing inside the chest, so nothing has spread internally. We're still dealing with external problems. So today, one of the surgeries that I am doing is that I am going and we're getting that golf ball size thing off the side of her chest. That's also going out for biopsy, and at this point, she already has an appointment with the oncologist in 2 weeks. She's going to see Dr. Vickery, my good friend from Myra, because at this point, amputation isn't even an option. And the cat, by the way, has no idea that she's sick or has anything wrong. That's the great thing about our pets. Don't tell them because they don't know. She feels fine. It has not spread internally. It's an external problem. And because of that, our chances of treatment are actually pretty good because the cat's eating very well and she feels great. She's running around the house, bouncing off the walls. And cats do amazingly, amazingly well with chemotherapy. The cats that I've had that have had it performed, they don't really get sick from it. They just kind of bounce through. So depending on what the final diagnosis is with our final biopsy and then what Dr. Vickery says, that will determine, what we're looking at for life expectancy. And certainly we don't want to keep putting this poor cat under anesthesia, but this thing that's sitting on the side of her chest came up so fast and is growing so rapidly. We pretty much have no choice. The good news is it's really not attached to anything. It'll be quick and easy to get it out. The kitty does well with anesthesia. So I'm feeling okay about getting that thing out of there and getting her biopsy off, and then hopefully having good follow-up with her. If this was a dog, we would have had a different scenario from day one because dogs are really good patients when it comes to, here, have some good food with some pills hidden in there, and they'll take them. And herbal therapy on dogs is always so much easier. Food therapy on dogs is so much easier. I can design diets for these guys and they pretty much go, okay, great, sounds good, I'll eat it. Whereas cats are like, I don't know about that. Or if they do eat it, they'll eat it once and that's it. So kitty cats are much more difficult. My other 3 patients today are dogs, and I don't have final diagnoses on these. These are ones that we did aspirates and things looked a little sketchy. So we're going in to get the lumps. As far as lipomas, no, they do not have to be removed if it just looks like a lipoma on your cytology and it does not appear to be malignant. Biggest problem with lipomas, which are fatty tumors, is they can get large, and they can they tend to follow the gallbladder meridian, which runs down here under the armpit along the kind of the side and bottom of the stomach, and then down the inside of the back legs. So when I find masses in those areas and I aspirate them and they look like lipomas, I usually have a pretty solid feeling that that's what it is. The biggest problem is if it's in an armpit and it decides to be the size of a grapefruit, it can interfere with mobility of the leg. So then we might recommend getting it out. I also, if they're really growing, I'd rather get them out while they're a decent size rather than waiting for it to be a watermelon, and then I have a really hard time getting it out because it leaves so much dead space in there. But lipomas are fairly dissolvable with herbs and food changes. So again, you've got to get away from the carbohydrates. You've got to use phlegm drainers because lipomas are really just, Abby wants to leave. Lipomas are really just a big pocket of abnormal phlegm that gets stuck there, and it's kind of walling off toxins. So we can get those dissolved. A lot of times when I put pets on a raw food diet and put them on some phlegm draining herbs, let's do that carefully. There we go. And put them on some phlegm draining herbs and foods, a lot of times people will report that the lipomas are shrinking, and that's a great thing. That's what we really like them to do. So, okay, I've got to get to work. I've got a ton of work to do today. We've got to pack for the expo today because we're hitting the road bright and early. I suspect that Breakfast with Spaniels will be on the road tomorrow. No, I will not be driving. So you get to see Hugh driving and me talking. Everybody have a great day. Golden paste, really good. You can use that. That definitely helps. And there's a video, how to make golden paste, on my website, drjudymorgan.com. Everybody have a good day. Good girl.